I'm Shanna. If you're new here, I'm a Canadian medical student and I make videos to help pre-meds and med students overcome different challenges in the pre-med journey. And today's video, we'll be talking about a non-traditional journey to medicine involving a career change and some tips on making this. So today I'm really grateful to have Jill, a medical classmate, for taking the time to give us an overview of your timeline.
After I graduated from undergrad, which I did it in medical laboratory science, actually my interest in medicine started in undergrad. When I was in high school, I actually had an interest in business. So I actually applied to business schools when I graduated. But I didn't get into UBC business school. UBC commerce is really hard to get in. So I was, for the first 2 years trying to, switch to business. So I did my undergrad in medical laboratory science, but my interest for business didn't diminish. I was still interested in business. So I thought to myself, what is a good field that can combine business and science? And then I learned about a program in biotechnology. So biotechnology is where I was in before medical school. I did a master in biotechnology. The program was at U of T called M Biotech. It was very business focused. So it really exposes students, just like me, with a science background, have an interest in business, to get a foot into sort of the biotech pharmaceutical industry. So I was in the program, I did my co-op, I learned a lot of business courses relevant to biotechnology field. And then I worked, after I graduated from my master's, I worked for 4 years in sort of the medical biotech industry. For the first 3 years, I was working at a Vancouver-based company that manufactures in vitro diagnostics, point-of-care in vitro diagnostics. Devices that the company makes are those that can help physicians decide whether a person, say, have heart attack or whether or not they have sepsis. They test for biomarkers in the blood. And then for 1 year before medical school, I was working at a big pharmaceutical company in sort of the R&D department, working on new therapeutic discovery, particularly in biologics. So identifying new antibody binders for specific disease targets. So those are my sort of life before medical.
I think a lot of people have this perception that going to medical school is very straightforward. It's just at some point somebody knows and then that's all they go through. But your path, which I think is super, super common, and I would say almost everyone, is you kind of thought medicine, but then you thought, and then you were like, oh, but maybe business, but then maybe medicine, but maybe business. And then you were like, why don't I do both? And I think nobody has to just go like linear. Everyone can go back and forth and then realize that they can merge. And I think maybe someone watching this can also realize that maybe they don't want to do medicine, but maybe now they know about this biotechnology program that you did. And that kind of field, and that can be an alternative if someone doesn't end up wanting to go to medicine. So the two different jobs you had in biotech, what was your job role? Were you part of the research team? Were you part of the business development?
First job was more like a product development. So our work does involve R&D, but R&D is not the only sort of aspect of my job at the time. We also do quite a bit of quality investigation. So for example, if a product has some kind of quality issue or complaints from the field, or some of the internal QC field, we are also the part of the team that does the investigation. When I was in that job, I also did a project that was between Canada and China. So our company collaborated with a partner in China to help them developing a diagnostic instrument. So that was sort of my first job. My second job was more R&D, was purely R&D. It was more about discovering antibodies that bind to our disease targets. And
I was curious more about the program that you did in Toronto. So
it really prepares students with a science background and with an interest in business to go into the business realm and to also provide opportunities to connect with industrial partners. Lots of the big biotech pharmaceutical companies, their Canadian headquarters are in the east, so in the Greater Toronto area. it was business focused, but it also has sort of a science aspects to it. And I think most uniquely, it provides you with a 1-year co-op opportunity to work with companies. It was challenging as well because it does challenge you to come up with business solutions, to be able to write a business plan, to tackle real industrial problems, and to play a consultant role to our industrial partners as well. So all those experiences are really valuable.
Can I spiral back and ask, like, what are some examples of the classes that you had to take for
Remember, there was a course where our professor, he would connect with industrial companies or people in the industry, or like hospitals, for example. So I remember in particular, I worked on a project at Sunnybrook Hospital where they were looking for solutions to redesign their crash cards. Whenever a patient code, the response team has to push through the crash card to the scene, and then the crash card will contain all the necessary medications and equipments, resuscitation of the patient. And I remember that particular project, we worked with Sunnybrook Hospital to look into ways to redesign the crash card, because there are a lot of issues. For example, what can we redesign the crash card to make it more ergonomic, to make it more intuitive, so that the users has minimum chance of grabbing the wrong medication during a time where it's very critical to not lose any second. We're also looking to, well, if we were to redesign the crash car, how can we prove that our redesign actually works? How can we gather data to even start redesigning, right? So those are the things the kind of problems that the course offers for a team to solve. So we were, assigned into teams, and each team tackles a different problem. And that specific crash card project was my team's project. It was a very interesting experience to kind of just propose our idea, to have that kind of collaboration and put our proposal out there. So that's an example of the kind of things that we did. We also took regular business courses like accounting, marketing. Pharmaceutical strategy is one of them that I personally took an elective in, is to kind of look into how pharmaceutical companies put out their drugs, how they do clinical trials, to make sure it's to increase chances of approval for the drug, and make sure that it's actually safe and efficacious for the patients. Like organizational behavior, some psychology that we need to do, lots of team-based projects. A very unique part of the program, I feel, is to offer students the opportunities to work in real life problems, to work with real life problems. And I think the reason that why I personally seek to do this program after undergrad instead of going to med school was because when I graduated from undergrad, I felt like I've been in school for too long. Like after high school, after undergrad, I've been in school forever. I have not had a chance to explore. So at the point when I graduated from undergrad, I felt like I wanted to explore and actually see some so-called real world problems, and so that's why I decided to work after my master's, and to gain some work experience and experience with the biotech field.
Because so much of the science classes, at least when you take organic chemistry or biochemistry or basic chemistry and stuff, I feel like I'm picking on chemistry, poor chemistry, but classes, I definitely felt like there's a time where you just feel so sick of it because it's all theory, it's all filling in problems, and we don't get a lot of relation to real life. I think we could change that if, for example, they had used examples like the ones you had in your biotech major masters, and like we had applied it to some of our learning. They're like, all right, you're learning this part of organic chemistry, and this is why we need to learn this, because it can be applied to this. But I think we get so detached from that that we
Mhm.
don't remember, and sometimes it feels like, what is the point of my learning?
If you're just learning knowledge, it's all in your head, it doesn't go anywhere. But having an opportunity for students to apply knowledge, to critically think of solutions to real life problems, it's really a worthwhile learning experience.
way they could do is, say they are a major in laboratory science or something, and they are interested in biotech. They could do on the side, they could find themselves to get interested in some of the health hackathons or get involved in side projects where they can apply the knowledge.
Mm.
I can't think of some like I think hacking health, and there's some other ones, or at least I know, for example, my brother's in engineering, so they have a lot of different teams where they can apply their skills to build like airplanes and things like that. So finding ways for yourself to apply your knowledge to the real world can, number one, just be super interesting, open you up, and some of the stuff you learn, again, like the stuff that we don't learn in classes, like how do you market your product, how do you package it and explain it to someone who is you're pitching it to, working
Yeah.
with a team and stuff. If you can go out of your way to find opportunities for yourself to apply and build those like extra experiences and skills in your life, I think that will make your undergrad much more fulfilling.
If you don't go out there to look for opportunities, they wouldn't just fall on your head.
Mhm.
um, Opportunities to seeking those opportunities outside of school, um, to find areas that you're passionate about, can really be not just good for you. They can also be really good for school application, um, because those experiences help you grow as a person. There's only so much you can learn from books and from school, but most of the learning actually comes from being outside, being in the world and interacting with people, and gaining experience in solving uh, different problems that we have.
And I really agree with your point that when people ask about choosing extracurriculars, I definitely agree that we do have to keep that in mind, because you do have to kind of play the game to go to medical school. But
Mhm.
the bigger picture, beyond doing that, it can be like you. For example, you were curious about what is it like, you always had that interest in business, and you were like, I might as well go do that. I think choosing extracurriculars, like maybe your basics to cover your basics, but then going on, you're like, I've always had an interest in business. Maybe I should pursue this. Or
Mhm.
maybe someone else has something else. Maybe they've always been interested in design or creative, work like that. And
Mm.
I think it would be cool to say, like, how can I explore this interest, this other interest of mine, and merge it together? So think of it in a different way, and that also I think feels less like begrudging, right? Like I don't think you particularly went in choosing the jobs that you did after your biotech major. Like I think obviously like those are going to be some things that are going to be huge boosts to your application, because it's very obvious, not very obvious, but to a medical school application reviewer or something, they can be like, wow, this person did this and this, it sounds super impressive. But on another level, probably before you embarked on it, you were probably just like, I just genuinely think this would be a really cool job or opportunity. So
I definitely didn't go into the jobs thinking that this is gonna be a booster to my medical application. I went into the job because I wanted the experience too, and it was nice. But it got a little bit too comfortable,
mhm.
and I thought to myself, it's becoming a little bit static for me personally. Like I felt like at that point, I feel like maybe this is the time where I go and try for medicine. Um, and and I did. It's the thought of that medicine is like kind of on and off
Mhm.
in my mind while I was working. Um, it I think I was waiting for a point where I felt ready for medicine. I think definitely during undergrad, when I graduated, I wanted to do business and I wanted to work. That was my goal at the time,
Mhm.
and I thought medicine can come later if I am still interested in it
Mhm.
after biotech career. Um, so I started working in biotech, um, and then after a year or so working in biotech, it came to a point where I felt that point I was actually quite frustrated with my work for a period of my time, um, because of the projects I was working on was really not going well at the time. So I got quite frustrated. I wasn't very happy in my job. Um, so that year, I decided to try to apply for medicine. Um, and I didn't get in. But I was like, okay, that's, expected. And um, it's, it's, most people don't get in on their first try, so it's okay. I didn't really prepare. I didn't even get an interview. That was my first cycle. And then, so then I keep on working, keep on working. And then when it actually reached to a point where I felt like, okay, I don't think I'm gonna be my happiest self. I wasn't unhappy. I wasn't super unhappy in my job, but I felt like something was missing. Um, I am interested in science. I'm interested in the business aspects of science, but what was missing is the human interaction. Because I was mostly working in sort of R&D, quality improvement positions. There wasn't a lot of human to human interaction, which is one of the aspects that I really enjoy, that human connection. So my thought for medicine came back, and I started really seriously thinking about it. I started, volunteering a little bit more in healthcare. Before I didn't do a lot of. I think in undergrad I did none volunteering in healthcare. I was doing other stuff that I was passionate about, like music. I was doing handbell choirs. I was doing other stuff, like nothing medicine related, because that was at the background, but not my top priority at the time. So I did nothing. But then while I was working, when I was seriously starting to think about applying to medicine, I then started volunteering in the hospital, like on patient wards. I had a full-time job, so I have to, for about maybe half a year, I was working the day, studying at night, and weekends I will also be studying and doing practice exams for MCAT. But long story short, I passed the MCAT and applied and got in on my third try.
What kept you going during that hard
I
time?
think what kept me going is because I really want to. Sometimes I think back and be like, whoa, I went through that.
Thank you to everyone who's watching. Drop a comment if there was something that really, something about that Jill said that really struck, really resonated with you, or if you have like a particular question, I can whip it over to Jill. I don't really feel like you left a lot of questions because you really shared a lot, but if anyone wants to share and have questions, feel free to leave them in the comments.